Thank you, Speaker. Firstly, I'd like to thank the government and commend them for the work that they have done to eradicate vaping in the way that they can. There's been so much hard work that has been done behind the scenes from public health agencies and health promotion agencies. Vaping, single-use vapes, was an absolute scourge, is an absolute scourge, I should say, and one that targeted our children in a way that was extremely cynical. So much so that schools in my electorate have had to install vape detectors in bathrooms because children were leaving classrooms to go and vape. And the impact that has had on children's behaviour and concentration, their ability to learn in school, has been absolutely horrific. What I would like to say, however, is I am disappointed at the watering down of what was a really incredible bill. I am disappointed. It is sad because it was a once, I guess, in a generation opportunity to really end the scourge of vapes and the targeting of our children with that. My concern is that the ability for vapes to be bought from without a prescription for people over the age of 18, the ability to buy over 9 will mean that people will go from pharmacy to pharmacy to pharmacy. Just as people doctor shop to get certain prescription medications, they will be shopping around their pharmacists. They will be able to get a large amount and they'll be able to on-sell those to their friends. Their 18-year-old friends, they'll be able to sell to the children who are already addicted to nicotine. We know that nicotine is one of the most addictive substances known to mankind. A large majority of children are already addicted to nicotine. When it becomes expensive, having to buy those those vapes, I should say, they will simply turn to smoking, to cigarettes. And so it is a gateway. It leaves the door open for vaping to continue, and it leaves the door open for that move towards cigarettes. So it is a cynical ploy by the big tobacco companies who want to start manufacturing these vapes. It is a cynical ploy to continue to get people hooked on nicotine, which is a gateway to smoking. So although I really support the measures that the government is trying to implement, I'm very disappointed that it's been watered down in this way, because I think it will only leave the door open to more smoking in our young people. Thank you. I'd also like to thank the member for Griffith for his contribution to this. I think so many of us here do not want to see the possession of small amounts of vaping material be criminalised. I concur with that fully. I'd just like to also concur with the member for Warringah in what will be the data collection around the purchase of vapes from pharmacies, because really that is required so that it is truly a therapeutic relationship and it's not being misused. So I'd like to hear from the Minister, if possible, about what will be the data collection from pharmacies. Thank you. I support the Greens amendment to decriminalise the possession of vapes, small amounts of vapes. One thing that I did want to say, though, was just picking up on the fact that no data will be collected from people purchasing vapes. That opens the door, as I said previously, for pharmacy shopping, to buy an amount from one pharmacy, 9, an amount from another pharmacy, another 9, and continue on like that. There does need to be data collected on people who are purchasing vapes, because otherwise that will open the door to on-selling of vapes in the future to young people.